Dear viewers, I hope you are all fine. This ultrasound video shows a case of missed abortion, also known as missed miscarriage, with the duration of pregnancy about 9 weeks. You can see the gestation sac in the uterus. The term early fetal death refers to the conditions in which a fetus is no longer alive, but the uterus has not yet started to expel its contents. A variety of terms were previously used to describe this condition, including blighted ovum, missed abortion, and silent miscarriage. Miscarriage is a word used to describe the early loss of pregnancy before 20 weeks of pregnancy. It usually happens in the first trimester. Unfortunately, between 10 and 15% of known pregnancies end in miscarriage. There are three hypothetical causes of fetal demise in first trimester. Parvovirus fetal infection, primary viral infection of myocardial cells initially causes myocarditis, leading to hydrops, cardiac failure, and demise. This is the first hypothesis. The second is bone marrow transit aplastic crisis occurs as the primum movens for anemia, leading to sequence of congestive heart failure, hydrops, and fetal demise. The third is placentitis. Placentitis without fetal infection causes placental dysfunction and ultimate fetal demise. You can see the fetus. There is no blood flow or fetal cardiac activity. No fetal movements are seen. Intrauterine growth retardation has various causes. The most common cause is a problem in the placenta, the tissue that carries food and blood to the baby. Birth defects and genetic disorders can cause intrauterine growth retardation. If the mother has an infection, high blood pressure, is smoking or drinking too much alcohol or abusing drugs, her baby might have intrauterine growth retardation. Women who retain the dead embryo fetus can experience severe blood loss or develop an infection of the womb. There are rare these are rare complications. Some babies die in the uterus before they are born, called intrauterine fetal death. It can happen during the last half of pregnancy or more rarely during the labor and birth. When it is known as intrapartum death, when the baby who has died during labor and birth is born, it is called stillbirth. So you can see there is no blood flow seen inside the fetus, no fetal movement, and no fetal cardiac activity is seen. Although a variety of terms were used to describe early pregnancy failure, in the presence of clear cut sonographic evidence that a non living embryo is present, the term embryonic demise should apply. Ultrasound diagnosis of miscarriage should only be considered when either a mean gestational sac diameter is equal to or more than 25 mm with no obvious yolk sac, or a fetal pole with a crown rump length of equal to or more than 7 mm without evidence of fetal cardiac activity. Transvaginal ultrasound is the mainstay in the diagnosis. Diagnosis of miscarriage. A missed abortion is a non viable intrauterine pregnancy that has been retained within the uterus without spontaneous abortion. Typically, no symptoms exist besides amenorrhea, and the patient finds out that pregnancy stopped developing earlier when a fetal heartbeat is not observed or heard at the appropriate time. An ultrasound usually confirms the diagnosis. So, in addition to the signs of the fetal life on sonography, subchorionic bleeding is an important factor. affecting the outcome of gestation in patients with clinical threatened abortion. The most common cause for first trimester spontaneous abortion is fetal chromosomal abnormalities. While most practitioners wait until at least 6 weeks to perform first ultrasound, a gestation sac can be seen as early as 4.5 weeks after the last period. A heartbeat can be detected as early as 5 to 6 weeks, though it might not be detected that early in all cases. A missed abortion is a missed miscarriage in which the fetus didn't form or fetal demise had occurred, but the placenta and embryonic tissue are still in the uterus. It is known more commonly as missed miscarriage. It is also sometimes called silent miscarriage. A missed abortion is not an elective abortion. Some women do not experience any symptoms of miscarriage at all. However, possible miscarriage signs symptoms bef- beside bleeding include mild to severe cramps, pain in the back of or abdomen, loss of pregnancy symptoms such as nausea and or vomiting, white pink mucus, passing tissue or clot-like material. To make the diagnosis with ultrasound, the findings may include but not limited to the absence of fetal pole, lack of growth of fetal pole with no evident cardiac activity, lack of yolk sac at the appropriate gestation sac, D-shaped yolk sac or placental separation. The umbilical cord forms by the fifth week of development, replacing the yolk sac as the source of nutrient for the embryo. Umbilical cord is a cord that connects the developing baby to the mother in utero. The umbilical cord attaches to the baby at the abdomen and to the mother at the placenta. The cord forms during the fifth week of gestation, that is, seventh weeks of pregnancy. Now the you can see the gestation sac embryo is also seen as the pregnancy measures about 9 weeks. Three main findings during ultrasonography are the absence of fetal cardiac activity, absence of fetal movements, and no blood flow seen on color Doppler. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.